Building Bridges, the AARTH Story.
My late son, Reverend Reginald Diggs, and Dr. Moses, a retired pediatrician from Tacoma, and I met many times in 2001 to discuss Reginald's frustration about the lack of response and support from the Black church because of religious dogma and stigma. Dr. Moses' frustration was really about the lack of HIV services for young Black females who were at one time his patients. And I, as a mother, was searching for ways to support my son and others in our community who were living with HIV. Now, our conversations basically resulted in a lot of questions for which we couldn't find adequate answers. It's been said, and you may have heard this, that change happens when you become unbearably uncomfortable with the status quo. So we concluded that we needed to be the response to the questions we were asking.
AARTH is
community,
steward,
empowering,
education, accessible,
adaptable.
The moment I felt the impact of AARTH's work was during the COVID-19 pandemic. AARTH was able to provide test kits and set up vaccination clinics at various churches, which was really helpful for our community. There were many people who were not looking to get the shots or the vaccinations, and through the use of our churches and getting information out and educating people on what the vaccine could prevent, I think was really helpful in our community.
We go out, meet people where they are, making health education accessible and easy to understand.
Whether it's HIV and AIDS, stigma, whether it is breast cancer, monkeypox, COVID vaccines, AARTH is very good at adapting to whatever the crisis is and making sure that there is a bridge to a solution for the African diaspora community.
From its inception in 2001, AARTH's first initiative to break the silence about HIV in the Black community was presented through a video titled, "Who Will Speak for Me?"
Where are you going? What road are you taking?
HIV/AIDS is the secret epidemic of the African American community. It is an epidemic that crosses all lines of gender, age, and sexual orientation in terrible numbers. It is secret because not enough of us, especially in our faith houses, have dared to raise our voices to speak the hard truth. And that silence is killing us. But the tide is beginning to turn. Who will have the courage to come forward? Who will speak for the men? Who will speak for the women? Who will speak for the children? Who will speak for me?
Our work is built around giving people the tools, knowledge, and support the need to take control of their health. AARTH doesn't just serve the community, it listens to the community and it creates programs based on real needs. People see themselves reflected in the materials and the conversations, which make the information more accessible and meaningful.
Working at AARTH, I find that I am very, very inspired by the impact that AARTH has on our community. The way that they have compassion for people, the way that they ensure that people get the things that they need, resources that they need that can help them to live a healthy and long life.
During COVID, we recognized there was a gap in technology for our elders, and through a grant, we were able to get about 100 laptops and offer training online to the elders. I think the oldest lady was 86 years old, and they were absolute beasts by the end of the training. We did 3 sessions, one on elements of a laptop, the basics of Zoom and Facebook fun. The young people see their grandparents on Facebook doing their thing. I say you're welcome.
In 2022, AARTH convened our first health equity conference in several years. It served as a critical place for shared learning, reflection, and action. Through keynote presentations, panel discussions, and facilitated dialogue, participants examined lessons learned from the COVID-19 pandemic. This event strengthened relationships across sectors, elevated community voice, and reaffirmed AARTH's role as a convener and a thought leader in health equity, anti-racism, and community-centered public health practice.
AARTH teaches, especially for the African American male, is the value of going, seeing your doctor regularly, and then following up on tests that you need to have.
During one of our prostate cancer workshops, people came ready to ask questions, but what really stood out to me was how safe they felt sharing their own experiences. You could see the relief on their faces when they realized they weren't alone, that they had a community who understood what they were going through, and having that safe space to talk openly about health concerns is so important, especially when it comes to topics people might not feel comfortable discussing. That moment reminded me why this work matters. When you create a trusted environment and bring resources directly to community, real healing and empowerment can happen.
There's something to be said for seeing someone who looks like you, that is knowledgeable, that can tell you the absolute truth about whether something is safe or what approach you should take. And so I think that's why AARTH has been successful over 20 years of working in our community.
That we put together care packages for our healthcare providers, people who care for those who cannot care for themselves. We want them to know that we see you, we understand, that this type of work is not easy or for the weak of heart, and it takes a true dedication. So we just want them to know how much we appreciate them.
Our work literally turns funding into real life-saving results.
One moment when I really felt this impact was during bingo size session, when I realized how committed the group had become. Many shared that they had more energy, they felt stronger, and saw better results from their doctor visits. For example, lower A1C levels, not needing certain medications anymore, and improved mobility and balance. One participant even gained healthy weight in the form of muscle mass, which helped support bone health, balance, and overall independence. People weren't just attending, they were coming back every week, encouraging one another and genuinely building relationships. This wasn't just like a 4-week class either. This was for 10 weeks, twice a week. And it really hit hard toward the end. And everyone was a little sad, like on our last day. But that's when I knew that the program meant more than just exercise. It wasn't only about the movement, playing bingo size, or the health education portion. It was about people finding community and feeling more confident in their bodies.
Younger people can get involved in continuing AARTH's mission by ensuring that they are properly educated with regards to the chronic illnesses and diseases in our community, such as high blood pressure, diabetes, and prostate cancer. Early detection and prevention can prevent these epidemics from continuing in our community.
If I could recommend anything or tell someone about AARTH, the one thing that I would say is that everyone can participate in AARTH in some ways. You can attend our free workshops, you can volunteer, or you can help spread the word about the wonderful programs that we provide. The more we understand about our health, the better equipped we are to care for ourselves and live a healthier life.